Welcome to KS Medical Coding Academy. This is lesson 2 of your full medical coding course. Today's topic is medical terminology, prefixes, suffixes, root words, and word building. Understanding word parts will make ICD-10 and CPT coding extremely easy. Let's begin. What you will learn today. In this lesson, we will learn what medical terminology is. Word part structure. More than 100 prefixes, suffixes, and root words. How to build and break medical terms. CPC exam-oriented examples. A mini quiz. And why terminology is essential for coding accuracy. Why medical terminology is important. Medical terminology is the language of medicine. It helps you understand diseases, procedures, and anatomy clearly. For coders, medical terminology is important because it improves ICD-10 code accuracy, helps you understand CPT surgical terms, reduces errors, and increases speed while coding charts. Structure of medical terms. Most medical terms are built from 3 key parts: a prefix at the beginning, a root or combining form in the middle, and a suffix at the end. Not every term has all 3 parts, but understanding this structure will help you decode any medical word easily. Word example breakdown. Let's break one example. Hypertension. Hyper means high, tens refers to pressure, and ion means condition. So hypertension means high blood pressure. This is how simple word breaking can be. Here are some of the most important prefixes. Hyper, meaning high or excessive. Example: hypertension. Hypo, meaning low or deficient. Example: hypoglycemia. Brady, slow, as in bradycardia. Tachy, fast, like tachypnea. Poly, many, as in polyuria. These prefixes appear commonly in diagnosis documentation. More important prefixes include dice, painful or difficult, as in dysphagia. Neo, new, as in neoplasm. In, without, like in urea. Inter, between, like intercostal. Intra, inside, like intravenous. And here are a few more commonly used prefixes. Pre, before, as in prenatal. Post, after, as in postoperative. Endo, inside, endoscopy. Ecto, outside, ectopic. Anti, against, antibiotic. Each prefix changes the meaning of the term significantly. Now let's look at suffixes. Suffixes usually indicate procedure or condition. Examples include itis meaning inflammation, gastritis. Oma meaning tumor, lipoma. Ectomy meaning removal, appendectomy. Otomy meaning cutting, tracheotomy. Ology meaning study of, cardiology. More suffixes include algia meaning pain, myalgia. Emia meaning blood condition, anemia. Osis meaning condition, dermatosis. Pathy meaning disease, neuropathy. Plasty meaning repair, rhinoplasty. And here is one more set. Scopy meaning viewing, endoscopy. Gram meaning record, mammogram. Lysis meaning breakdown, dialysis. Stomy meaning opening, colostomy. Megaly meaning enlargement, hepatomegaly. Root words or combining forms give the core meaning of the term. Examples include cardio, heart. Neuro, nerve. Hepat, liver. Nepher, kidney. Gastra, stomach. Some more root words are derm, skin. Hema, blood. Osteo, bone. Pulmo, lung. Arthro, joint. You will see these very frequently in ICD-10 coding. Combining vowels connect root words and suffixes. If the suffix begins with a vowel, do not add a combining vowel. Example: gastra plus itis equals gastritis. If the suffix begins with a consonant, use the vowel O. Example: ner plus O plus logy equals neurology. Medical words follow 4 simple construction rules. 1. Root plus suffix. 2. Prefix plus root plus suffix. 3. Multiple roots plus suffix. 4. Use combining vowel O when needed. If you know these rules, you can build any medical term. Word building examples. Let's build a few examples. Cardiomegaly, cardio plus megaly, meaning enlarged heart. Nephrology, Nephro plus logy, study of the kidneys. Osteoarthritis, osteo plus arthur plus itis, inflammation of bone and joint. Word-breaking examples. Now let's break complex terms. Gastroenteritis, gastro plus entero plus itis, inflammation of stomach and intestine. Polyneuropathy, poly plus neuro plus pathy, disease of many nerves. Coding-oriented examples. Here are some terminology terms you will use directly in coding. Dysuria, painful urination. Hepatomegaly, enlarged liver. Cholecystectomy, removal of gallbladder. These appear frequently in ICD-10 and CPT documentation. CPC exam word list. These medical terms frequently appear on CPC exam questions: hemiplegia, osteomyelitis, pneumothorax, cyanosis, leukocytosis, and cardiomyopathy. Understanding the word parts makes answering exam questions faster. Must know abbreviations. Here are commonly used abbreviations in medical records: SOB for shortness of breath, BP for blood pressure, UA for urinalysis, CBC for complete blood count, HX for history, DX for diagnosis, and TX for treatment. Terminology for ICD-10. ICD-10 coding depends heavily on terminology. You must understand terms related to body location, severity levels, laterality, acute or chronic conditions. Medical terminology helps you decode these instantly. Terminology for CPT. In CPT coding, you will frequently see terms such as endoscopic, laparoscopic, open procedure, excision, resection, repair, reconstruction, and many more. Knowing terminology improves your accuracy in procedure coding. Let's do a quick quiz. Break the following terms into prefix, root, and suffix. Hypoglycemia, hyperthyroid, gastrectomy. I will show the answers next. Here are the answers. Hypoglycemia, hypo plus glyc plus emia, low blood sugar. Hyperthyroid, hyper plus thyroid, high thyroid activity. Gastrectomy, gastra plus ectomy, removal of stomach. Today we covered 50 plus prefixes, 50 plus suffixes, common root words, combining vowel rules, word building, CPC exam terminology, and coding applications. Mastering these terms will help you become faster and more confident in medical coding. This completes Lesson 2 of the KS Medical Coding Academy: Medical Terminology, Prefixes, Suffixes, and Word Building. In the next lesson, we will learn anatomy basics for medical coders, which is extremely important for ICD-10, CPT, and procedural understanding. Thank you for learning with KS Medical Coding Academy.